Welcome to VASER Lipo 101. I'm Tanya Atagi, and I'm a plastic surgeon here at Atagi Aesthetics in Lone Tree, Colorado. We're in the southernmost part of the greater Denver metro area. And we're going to talk today about VASER Lipo. VASER liposuction is a liposuction technique that was introduced by Sound Surgical, and it really, in my mind, revolutionized the way we can do liposuction. So in talking about liposuction, let's talk about fat first. So our best candidates are patients that are probably really pretty close to their goal weight, but that doesn't mean that you have to be really close to your goal weight. But it really works great if we're going to be doing some contouring and sculpting that you might not be able to do with diet and exercise. At the same time, people do sometimes do it to get a good jump start as far as getting started with a good diet and exercise routine. But for the most part, we're all born with a fixed number of fat cells. So if you think of a fat cell as being a kind of U-Haul storage unit for fat, we're all born with a fixed number of U-Haul storage units. And so when we gain weight, basically what we're taking is any extra calories and filling those U-Haul storage units, as opposed to making new fat cells. So of course, when we do liposuction, you can imagine that we're actually getting rid of those U-Haul storage units. So that's what helps in terms of reducing any particular area. At the same time, liposuction is really not cheating, because you still have to be careful with your diet and your exercise, because if you decide, oh, hey, I've had my lipo done, I'm going to go out and eat 10 Big Macs every day, you still have U-Haul storage units somewhere, and so we don't always know where those next areas are going to be that are going to collect those extra calories. So generally, if we have particular problem areas, it might be the outer inner thighs, particular for women, or the flank area, or that spare tire for the guys. Those areas tend to be our, what I call primary fat stores, meaning the first place any extra stuff goes and the last place it comes off. But again, you have to be careful, because you do have those secondary stores, and where might that be? Is it your neck? Is it going to be the backs of your arms? Whatever it is. So it's not really cheating. You still have to maintain good diet and exercise. But at the same time, if somebody tells you, oh, well, it's silly to do it because it just goes somewhere else, it doesn't really just go somewhere else, but there is that potential to gain weight or gain disproportionately in other areas. So it's not really cheating. So that's one thing to kind of keep in mind. With the technique itself, so when we talk about traditional liposuction, we usually are talking about two steps. So the initial step, after we make a little poke hole so the incisions are really small, we put in fluid into the fat. And the fluid, if we're doing it here in the office, which is a possibility, we do have numbing medicine in there. And so it either has numbing medicine and usually some epinephrine. So epinephrine acts like adrenaline, which is that stress hormone. And the way it works is it constricts the blood vessels. So what it does is it decreases the amount of bleeding, bruising, swelling, all of that. So if we're doing it in the operating room, usually when I make up the fluid, we use just the epinephrine because you're already asleep, so we don't need the numbing piece of it. So that's the initial step, is we put fluid into the tissue. It helps to tense up the tissue, numb the area, decrease the bleeding issues, and it makes it easier to do the liposuction. So with traditional liposuction, usually the next step is to take the long hollow cannula, insert it, and if you've watched any YouTube videos or whatnot, a lot of times, it looks very traumatic. You see a lot of force. So that's more traditional liposuction. But the great thing about the VASER Lipo technique is there's a second step, an in-between step, where it's still a long probe that we use, but it's solid, and the tip vibrates at ultrasonic frequency, just like your ultrasonic toothbrush might. And what that does is it actually breaks up or emulsifies the fat. And what's great about that is it helps us to minimize the trauma to the tissue. So it doesn't injure the blood vessels, So you'll get less bleeding and bruising, and it decreases the trauma to the lymphatic channel. So the lymph channels are what helps to get rid of swelling. It helps to absorb that extra fluid from the tissue and take it away. So you can imagine if you're getting less bruising, less bleeding to begin with, you're also likely to get less swelling, and then you're going to absorb any fluid and any bruising that you might get much more quickly if you haven't damaged the lymphatic drainage channels. So in my mind, the technique is a lot less traumatic, and if you look at the VASER Lipo website, I think a lot of times it'll say it's less invasive. So in my mind, that's not necessarily the case, meaning, yes, we're still putting in tumescent fluid with a long cannula. We're still using a probe into the tissue, and we're also using that suction cannula to get rid of the fat. So I think technically it's not necessarily less invasive, but at the same time I think it's much more less traumatic. So the reasons that I like the VASER technique in particular, even though we're adding another step, is that there are areas of fat that are very buttery. So the fat is very soft, it comes out very easily. So you can imagine if you're doing traditional liposuction, it's still going to be probably reasonably easy to get that fat out. But there are lots of areas where the fat is very adherent to the surrounding tissue. It can be very fibrous. It can be very challenging to remove that fat. And if you've had any procedures in those areas where you might have scar from prior liposuction or surgery, those areas are going to be very fibrous as well. So the nice thing about the VASER technique is when you ultrasound that area, it breaks up the fat, and so it comes out much more evenly and I think much more smoothly, because you're not finding that the stuff that comes out really easily just comes out, and then you're left with kind of pockets of areas where it's very hard to get the fat out. So I think with the VASER Lipo technique, the advantages are that it's a lot less traumatic. I think the recovery is faster in terms of swelling, bruising, coming down more quickly. Some of our patients really get almost no bruising at all, although I can't promise that to everyone. I would say that with traditional liposuction, everybody's going to get a lot of bruising. If you get much bruising, it's going to resolve much more quickly. And I feel like the results are better because they're going to be a lot more smooth, less lumpy bumpiness, and we can work in areas that are much more fibrous, like the back, for example, and areas that you might have had surgical procedure done previously to try to smooth things out. So from that standpoint, I feel like the VASER Lipo technique is far superior to traditional liposuction. And there are other techniques out there using radiofrequency or water, but I found that I've been very pleased with the ultrasound technique. And people talk about laser lipo as well. And I think the disadvantage of that is that the laser probes are very small, so it takes a very long time to work on a larger area. And also, there's always the risk of heat injury or burns with some of these other technologies. With the VASER technique, because it's ultrasonic vibration frequency, I think that you can still generate some heat with the friction, but for the most part, it's not really inherently a heat-generating technique. So it's more of a mechanical action where that vibration creates what we call little cavitations, but it creates little micro bubbles that knock the fat off of the stems. So that's what helps to kind of smooth out and emulsify that fat before we're removing it. And if you watch me do it, it's a very smooth technique. I don't need to use a lot of force, and I think that that really just defines the fact that it's a less traumatic procedure. So when I use that ultrasound probe, it's like using a fiddle, and so that breaks things up first, and then when we go in with the suctioning, it's really just aspirating and suctioning out the fluid that's already been broken up. So it's a really nice technique from that standpoint. So that's kind of it in a nutshell in terms of the VASER Lipo 101. We are offering a special this month, so it's February 2017 if you're watching this live in this month. So if you call in and mention that you watch this clip, we'll give you a free consultation for this month. So please mention the clip and you'll get a complimentary consultation. So till next time.
We have a question.
Thanks. Oh, great. So we have a question.
The question is, how would I know if I was a good candidate for lipo?
Right. So it depends, meaning I think most people, if you have any pockets of areas that you're not liking, that's external, you're probably a good candidate. The only area that we, I think, really need to evaluate is the abdominal area. So particularly if you're a patient who's had a big weight gain or weight loss, have had a pregnancy, you may be a better tummy tuck candidate. Because if you think about how liposuction works, it really only addresses the fluffy layer or the fat. So if you've had children, you may have some muscle separation or a little pooch resulting from that because you don't have that abdominal support from the muscles. You may have a lot of skin looseness or excess from weight loss or from pregnancy. So sometimes the liposuction can make some situations like that worse in terms of if you've already got a loose sac, basically. So we're kind of talking about the stuffing versus the sac, and we're emptying out the stuffing. If you don't have much elasticity in your sac or in your skin envelope may not retract well. And that may not be a concern to you, meaning if your goals are such that you just want to fit in your clothing better as opposed to having, say, a perfectly tight, flat abdomen, then you may be a good candidate for it, even if you do have some skin looseness. If you're a patient that's lost a lot of weight, and again, you have a lot of skin excess, you might be more of a lift type of a candidate, whether it's for the breasts or for the inner thighs, the buttock area, the abdomen. So if you're really looking more for contouring, fat or fluff reduction, then you're likely to be a really good candidate for lipo. And there are a lot of areas that we can use the VASER Lipo. So in the neck area, but again, if it's really more loose skin, that the VASER Lipo may not make sense for you. But if it's fat, that area is great. The backs of the arms. We do breast reductions for both men and women, and that's a great technique, especially if you don't have a lot of sagging. The abdomen's a good area. The flank or hip roll areas, outer inner thighs, occasionally the calves, as long as it's not intra-abdominal. Those are all really great areas for VASER Lipo. All right. Great. So I think that's it. Again, look out for our next clip, and we'll see you then.